Coronavirus disease, or COVID-19, is actually the disease caused by SARS-CoV-2. It stands for Severe Acute Respiratory Syndrome Coronavirus 2. I'll say that 5 times fast. Severe Acute Respiratory, oh good lord. Severe Acute Respiratory Coronavirus, I can't even say it. Severe Acute Respiratory Coronavirus 2. Is that it? Yeah. So today I want to tell you how I almost lost my job to the pandemic, how it affected my salary, and how it changed the way we practice. Coronavirus has affected the way of life of just about everyone around the globe. It has greatly tested the medical community and made us reevaluate our own protocols on how we can prevent the spread of infection and disease. Unfortunately, many people were furloughed, let go, or even fired during the pandemic, and this happened to the medical community as well. Businesses have been forced to close, causing huge emotional and financial stress for a large number of American households. And the medical community was not exempt. As emergency rooms and intensive care units were filled to the max, there were many medical specialties that weren't on the front line who were also affected. Since I'm in orthopedics, I actually don't see patients with a known active COVID infection. However, the virus did present a challenge that affected my ability to practice, almost cost me my job, slashed my salary, and changed my workflow. One of the problems with an infectious disease like coronavirus is that for those in the medical community who aren't on the front lines, life still goes on. There's still people with knee pain. There's still people who have asthma that need to be treated. There's still people with heart attacks. Life still goes on, and people get sick from other sources as well. People still have knee pain and come see me for evaluation and treatment. We also have to make sure that we are not vectors for spreading the virus and infecting other people ourselves. And more than that, hospitals have a fixed capacity. As the numbers began to spike last year, in order to make sure they had a reserved number of rooms for patients with an infection, many of the hospitals started closing the operating room except for the most urgent and emergent cases that needed operation. So we went from doing 8 to 10 surgeries every single week to 0. But not just the hospitals and surgeries themselves, even the clinic completely changed once coronavirus hit. Patients were scared. In our clinic, we saw people stop coming to their appointments because they were afraid that they may catch the virus. And on the other hand, some people actually quit coming because they lost their job. On the clinical management side, there were actually talks of all the employees being furloughed, pretty much laid off of work for a few months until the hospitals opened back up and everything opened back up to normal again. After lengthy discussions and analysis, it was decided that the physicians, nurse practitioners, and PAs were going to be taking a 30% pay cut in their base salary and removal of all bonuses for this year. This not only happened to my clinic, but it happened to a bunch of other professions in the area. The CRNAs, the nurse anesthetists, they were also continuing to work, but at 70% of their base pay. So you had certain cases where you had advanced practice providers and physicians working even longer hours now at a reduced rate. So we went from 8 to 10 surgeries a week and full clinic days to no surgeries a week and like half-day clinic. Fortunately, this only went on for a few months this last year before things returned to normal. I guess you could say the new normal now. God, I hate that term, but it seems that that's what we're going with. So things I learned from this experience: 1, you are always replaceable, no matter how good you are. Also, reflecting on the whole situation, I always thought that as a salaried employee, that at my worst, I would never fall below the baseline salary that I received. That's incorrect. It definitely made me realize that 1, we are replaceable, and 2, you really have to look out for yourself. There was a large hiring freeze. Like, their main focus was, how can we retain the employees that we have without having to lay anyone off? Fortunately, things are starting to return to normal, and a lot of those medical companies and hospitals, clinics, they are starting the hiring process again because there is a huge medical need out there. So even in the midst of this pandemic, PAs were selected the #1 career for 2021. So if you're currently in school or you're worried about the future, I would say keep your head up, stay positive, and keep going forward. Your perseverance is going to pay off. I want to be clear my intentions. This video is not meant to be like, oh my gosh, I'm so sad and woe is me. I know there's a lot of people out there who had a much worse experience, who did lose their job out there. And luckily I didn't have that happen to me. Although for a little bit there, it was questionable. We didn't know which route we were going to take. So I hope you enjoyed this video. Leave me a like and a comment in the section below. Subscribe if you haven't already, and I'll see you next time. Severe Acute Respiratory Coronavirus Syndrome 2. Dang it. Severe Acute Severe Acute Respiratory Syndrome Coronavirus 2. Okay, I'm kind of through with it now.